Good afternoon and welcome to today's webinar titled Acceleration of Mobility in Healthcare, presented by Healthcare Innovation. My name is Rajiv Leventhal. I'm the Managing Editor of Healthcare Innovation. Today's program is sponsored by ePlus Technology and Code Corporation. Thank you so much to our sponsors and of course to our audience for giving us your time and attention today. Before we get started, we do have a few housekeeping details to go over. To submit a question, please use the Q&A box to the left of your video window at any time. You do not have to wait until the end of the program to submit a question. For technical issues, please press F5 to refresh. If that doesn't work, you can submit a question with your issue through the Q&A panel. Finally, we strongly encourage you to join our discussion on Twitter today. You can tweet using the hashtag HILiveWebinar. We look forward to that conversation throughout the program. At this time, I'd like to introduce our speakers, and first I'd like to pass it off to George Pashardis, who's the Vice President of Healthcare at ePlus Technology, a consultative technology solutions provider that helps customers imagine, implement, and achieve more from their technology. George brings more than 30 years of experience in his role serving customers in one of the IT industry's and country's largest industry sectors. George, with that, the floor is yours.
Thank you so much. Excuse me. Good afternoon, everyone. Good morning to all those on the West Coast. Again, my name is George Pashardis, VP of Healthcare at ePlus. Thank you all for joining us. So on behalf of ePlus, I would like to thank our main sponsor here at Code Corp, for today's webinar. Really appreciate the partnership that we have together with Code Corp. With today's webinar being on acceleration of mobility in healthcare, we all know that this is such an important topic as the number of mobile devices within a hospital is growing at a tremendous rate. For those of you who are not familiar with ePlus technology, ePlus serves a wide variety of organizations in both the public and private sectors, including the Fortune 500, healthcare, of course, federal, state, local government, K-12, and higher ed, as well as other vertical markets around the world. Founded in 1990, ePlus has more than 1,500 associates, serving a diverse set of customers with presence in the U.S., Europe, and Asia-Pac. We went public in 1996, and today our fiscal year 21 gross billings are $2.26 billion. With over 600 technical and support resources, we have the highest certifications from top technology partners and expertise in key technologies from data center to security, cloud, and collaboration. Here in the U.S., we have 4 managed services centers and 3 integration centers. Hospitals and healthcare organizations across the country rely on ePlus to optimize their IT investments and deliver state-of-the-art patient care. From telemedicine and telehealth to mobility solutions at the point of care, big data analytics, and IT security solutions, we can be engaged for the entire project, including analysis and design to deployment, documentation, support, and beyond. ePlus also offers flexible extended payment and finance options to help our healthcare organizations overcome budget limitations and maintain regular refresh cycles. Next, I would like to introduce to you our moderator, Ken Puffer, CTO of ePlus Healthcare, and Kent Bandy and Lori DiCarlantonio, both regional managers at Code Corp. Thank you very, very much. Ken?
Thank you, George. So we're going to get this kicked off today with Lori and discuss the tools and technologies that Code Corp brings to the table for our healthcare customers. Lori?
Yeah. Thanks, Ken. My name, again, is Lori DiCarlantonio. I am one of the regional managers here at Code Corporation. We are one of the leading barcode scanning manufacturers. Today, we are going to discuss healthcare mobility, And, we're going to put some use cases in front of you. So today, we are finding more and more iPhone and Android devices deployed throughout healthcare systems. And in order to accommodate all sorts of workflows and applications available, the users are looking for one device. So whether they're going to, utilize an iPhone or an Android device, they're bringing all those applications to reside on one device. So now what they're using those devices for is updating EHR systems, which are your electronic medical records, your care team communication, so you can talk to your care team members, assessing medical research, and also positive patient ID verification. And a lot of these common areas and these common use cases, you're in need of barcode scanning. So we have available today, due to all of these changes, our Cortex Decoder soft scanning SDK. So what that means is we're able to take that iPhone or Android device and enable the scanning ability through your camera. So you're able to update those EHRs, or you're able to identify that patient. And impact areas that you'll find below is in vaccine administration centers. We've deployed a lot of Cortex Decoder in those areas due to the excessive vaccines that we've had to deal with over the course of the year. Med administration. Making sure you're delivering that right medication to that right patient. So you're needing to scan that wristband, that barcode. And in order to do that, you're scanning it with the camera, and then you're updating your EHR, your electronic medical records. And you're creating a positive patient and ID verification. Vaccine administration and tracking is another impacted area. Pharmacy, again, with meds, key point of scanning and making sure you have that right med for that right patient. Lab and specimen collection, blood transfusion verification, EBM identification, so express breast milk, making sure that mother is giving the right breast milk to the baby. Supply chain management, so anytime that you have product coming into your facility, you're able to scan it and properly distribute it to where it needs to go. And asset tracking. So by using our Cortex Decoder soft scanning SDK, all those common pain points are solved. When it comes to freemium versus enterprise, our Cortex Decoder is built by barcodes experts. There are no ads that you see, or there's nothing that pops up. Read barcodes of all conditions and all symbologies, and it's configurable to the customer needs. Cost. We're looking now more and more to cost. Budgets are being cut, so this option here and availability is less expensive. It's easily upgradable, and our cost is per license, per device. Mobility, you can input capabilities to products you already have. Again, it's for iPhones and Android devices. You're already deploying those when it comes to the multiple applications and downsizing in the sense of not having to be tethered to a computer. So it frees up your ability, and obviously you're making yourself more mobile. And then within workflow, it reduces the number of devices and the multifunctional investment. So our Cortex Decoder soft scanning SDK offers customers one solution to solve many challenges that exist. Why Cortex Decoder software? We are integrated to all of the leading EHR integrators and hospital systems. So whether it be Epic, Cerner, Meditech, Allscripts, each one has a mobile application, and we have been integrated to each one of those. If you happen to have one on board that you do not see here and not currently using an Epic, Cerner, or Meditech, that's fine. We are able to get you up and running on the Cortex decoder. We have a team in-house that can write on the JavaScript in order to get you in our SDK integrated into your particular application. Same decoding platform and algorithms that we use in our hardware scanners. I'm not sure who on the line are familiar with those, but we have a variety of wireless and wired scanners that all of our scanning capabilities are on the same platform and written to the same algorithms. Industry-leading scan rates is 6 times faster than our competitors. Camera flexibility in mobile devices. We have superior reading of poor quality barcodes, and we're most supported barcode symbologies on the market. Proven with 20 plus years experience, so that's why I said we are one of the leading barcode scanner manufacturers with all of that experience. Flexible OS portability covering all major platforms, and low cost to entry. Now I would like to hand it over to Kent Bandy. Kent?
Yeah, hello, everybody. I had to get myself off mute. Those things happen to us sometimes out here. Just wanted to let you know first that I'm based in Raleigh, North Carolina, and that I cover the Carolinas, Florida, and all of the Mid-Atlantic. I've been in the auto ID industry since 1996, and more specifically working in healthcare for the last 17 years. Code is not just a barcode scanning company for healthcare. We also work within many other verticals. You guys recognize that barcodes are used in many, many areas. And I did notice that in our audience, there were some people that were outside of healthcare. So I might touch on a couple of things that are being done outside of healthcare by Code Corporation. First of all, we've talked quite a lot about Cortex Decoder. This is, the camera-based scanning system that we actually went first to Epic to actually work within what's their product called Rover. And we did this because we wanted to get validated by them, and we wanted to make sure that this app would not have to be put into something like an Apple app or an Android app, but work directly within Rover. We do the same thing with Cerner, Meditech, and Allscripts. What that means to you, to the hospitals, is that all security of information for patients is actually within the EHR or the company that is involved with that. The 4 that I mentioned are the largest 4 in hospitals right now. So security is not an issue for these hospitals at all when it comes to our software. I bring that up because we also have our CR7020, which actually covers is a case for the iPhone 7, the 8, and the new SE. What's very important about this is Apple has begun to recognize that in healthcare, they needed to standardize on a size of a phone. They are a consumer company that wants the young people to buy the newest phone, move up to the newest and the greatest and the larger and things like that. But 2 Apple reps have explained to me that they recognized in healthcare, hospitals typically want to use these phones for 2.5 to 3 years. And they don't want to have to buy different cases every time they go from one phone to the next phone. So I've been told by the Apple people that this is really their de facto unit, the new SE. And R7020 actually covers that phone. It also has Dragon Trail glass on the front of the case so that the actual face of the phone is well protected. We have Code Shield plastics. We're going to talk further about that when we get to the next couple of slides. Very important. the most abrasive cleaners out there being used in healthcare can be used on these plastics. We do have a quick swappable battery, which allows the phone inside of the case to actually work a 12-hour, 14-hour shift before a battery has to be replaced into the case itself. We do have 5 and 10 bay chargers also. We have a new thing called bidirectional data pass-through with our newest product, the 7020. And what's so important about this is that there are hospitals out there that are presently using software, add-on software. Happens to be a group called Ground Control. Ground Control allows them to actually sign on to multiple applications on their phone, and it allows them to just touch their employee badge to actually do that. So it's important that we can pass data both ways, to and from, to be able to work within those other software platforms. So it makes it much simpler for the nurses to sign on 3 or 4 apps at one time. We also have a battery track app, which allows you to see when the batteries were first bought, and allows you to see where the lithium-ion battery is in its health. You know, is the capacity after a year really 75%, 80%, those types of things. The unit itself, the case, is very, very strong, sealed, secure, protects against debris and damage. Several things that are important about the case are that it is not what's called a sled. A lot of people, we used to also manufacture and sell sleds, but a sled is known as a unit that has an actual scan engine in it. It makes it, typically it's purpose-built. It could be an Android device, and so it's much more expensive. It also doesn't give the flexibility that a case and software gives. Also heavier. So cases are really the way to go now, because the iPhones and the Android devices are being deployed in so many different hospitals now. So the 7020, we're going to talk about later on how to get demos, but it's extremely important that you know that we want to be involved from the very beginning of any application at your hospital, or if you're actually somebody that works with hospitals as a consultant. So we did mention about our infection control. As everybody knows, this has always been a big issue inside of healthcare, but it's gotten even more so because of our COVID pandemic. And it also is now touching other industries. For those of you who are not in healthcare on the call, it's touching point of sale industries. It's touching other areas that anybody that's involved with barcodes, the product that they're scanning with needs to be able to be cleaned. And what's important about this, you absolutely do not want your plastics breaking down on a barcode scanner or on the case that we just saw. If it breaks down, it creates cracks around the edges typically. That creates the ability for all kinds of different fluids to get inside of the case. And you guys know what the wrong kind of fluids that can get in there, how that can damage an iPhone or an Android device. So we actually do have levels on our Code Shield product. Probably the one to point out to you mostly in healthcare is level 3, because level 3 covers all of level 1 and 2. You have to think about in hospitals that they use some of the most abrasive cleaning out there. A lot of bleach-based stuff, the Caba wipes. A lot of people call that purple top one up there. You see a purple top Santa wipe. And all of these, we have the ability to use on the plastics without any breaking down. And if you look down under Code Shield Level 3, it's very likely that you will recognize some of these actual cleaning devices. While we're here, I'll bring up one of the hospitals that I sold the case, the 7020, along with the software to. That is Vidant in Eastern North Carolina. And Vidant wanted to decrease the number of workstation on wheels that went into rooms. They wanted the ability to have the nurse just carry the iPhone with our case on there, and they wanted that ability of only cleaning the case and not having to worry about the workstation on wheels or worry about a thin client that could potentially be in the room with a barcode scanner. So, of course, with mobility, those things are very much improved. And that was one of the reasons Vidant went for that. I will also mention that Duke is another customer, and I think that Duke people are on the line right now. I saw one person. They are using our scanners, but they're also using our product, the case, and our Cortex decoder software product in what's called their transportation area. And most of you, anybody that's a hospital on the line knows all about that, moving patients between areas of the hospital. And so they, in turn, wanted to be able to do that, but they also wanted to have the case to be able to clean it properly and be able to take one patient from one area to the next. And that's all part of their EHR also, or their EMR, and we, of course, work within that with our Cortex decoder software. Cleaning of any product is very important, and we have plastics that allow you to do that. Now let's talk about some of the hospitals and the use cases that we have out there. You might want to look below. You'll notice a lot of different logos for hospitals that are in Lori's territory. I'm going to talk about some of the ones that are in my territory. There is something called hands-free scanning. And what we mean by that is if you look at the picture to your right, we have a monitor bracket that fits on the back of the monitor. You will notice that there is a flange here. With that flange, there's a hole in the bottom. This is our charging cradle. This charging cradle is being used at Duke with either our handled CR2700 or the Palm device. Again, we have the same level 3 healthcare plastics on both the cradle and the scanner itself. Duke previously was using a different workflow, and in that workflow, they weren't able to do hands-free scanning. What we mean by hands-free scanning is this particular person is using both hands to present the barcode, but many nurses only use one hand to present the barcode, and then they have the other hand free. This has really increased the workflow and the speed of the workflow at Duke in particular. It's also being done at a number of other hospitals in my territory. Another company or another hospital is Meritus. So this particular workflow, of course, uses a workstation on wheels. And there are a number of workflows inside of hospitals that will continue to use workstations on wheels in thin clients in the rooms because mobility doesn't fit well into every one of those workflows. We have been working with hospitals for the whole time that we've been around, 25 years. They were our original, hospitals was our original vertical that we got involved in. And as mentioned before, we are in a number of other verticals now. One of the most important things was that we also introduced inductive charging. What we mean by that, with this cradle, is it's wireless inductive charging. So there is no exposed metal anywhere on this scanner or in this cradle. And what's important about that is previously competitors and our previous unit, the 2600, had metal pins on both the scanner and the cradle, the charging station. The issue with that is that when these products were cleaned properly, if the scanner was put back in the cradle right away, which most nurses would do that, and they have so much other things to do, scanning needs to be quick for them. And so that when they put it back in, over time, corrosion could be created on those metal pins, and that would keep the scanner from charging. We bounced around there all of a sudden. Keep the scanner from charging properly. We no longer have that issue because wireless inductive charging has no exposed metal. It's kind of like your Apple Watch that you just lay on top of the charger. No exposed metal there. And one of the things that we got that from was the customer feedback that we have. And I'll mention a couple of things about that customer feedback. It's important with code that we've been around so long in doing this, but secondly, we have all engineers that answer the phone when you have an issue. And those people are very well versed on any kind of issues that may occur. And what's important about that is we have a callback within 4 hours, worst case scenario. We do surveys constantly, and we do have a 99.3% satisfaction that we get back from these customers. So that's really exciting. We're also looking at your feedback to determine what's the next thing that we should be doing. Moving back to Cortex Decoder, another group that was on this call is UNC. They have thousands of our licenses there inside of cases. Some of their cases actually cover the iPhone 8s and SEs that they have, and they use our software to scan all barcodes inside of transportation, inside of blood transfusion and taking lab work, but also, of course, at bedside administration of medication. And Jill McKinney at Novant, which is one of our other larger customers, they have thousands of licenses too. The comment was made by her that was actually put into a press release. Using the mobile devices to scan and administer medication has been life-changing for Novant. So this was a very great thing to be able to put out there for us. I know that there are a number of other hospitals on the line that use code, and we want to make sure that we're always there for you and would love the opportunity to get involved with hospitals or consultants or others who are on this call today. So now I'm going to hand over to Ken from E+ to talk about our panel discussion.
Thank you, Kent and Lori. That was a great job, and I really appreciate the level of depth that you went into. But if you guys don't mind, we're going to dive a little bit deeper into your products and technologies. In our conversations with our healthcare customers across the country, one of the things that you touched on, Kent, was really the frustration that the clinicians face when they go to pull a portable scanner out of a charging cradle and it isn't working or isn't working properly, and that can create additional work for the staff on the unit. They become less efficient, and the help desk or desktop support staff has to respond, either replace the scanner or at least troubleshoot it. And one of the key improvements that I know that everybody appreciates is that inductive charging when you have to have those fixed devices. The move to mobile devices and mobility to be able to produce more functionality in a single device, is great. And the ability of the Cortex software to interact natively with or integrate with, things like the Rover application is really helpful. So, can you give us a little bit of insight into the different scanning workflows that you've seen in healthcare? I know that Lori touched on a few of them earlier with, pharmacy, laboratory, med administration, positive patient identification, things of that nature. But can you dive into that a little bit deeper?
Sure. I'd be glad to, Ken. So the things that were just mentioned are things that I will also touch on about workflows. I'll go all the way back to 17, 18 years ago when we were working with the first hospital that I got involved with, and we had to first of all work with the pharmacy. We had to get involved with actually getting things. I'm sorry.
So I know that the pharmacy has a big need for maintaining inventories, making sure that all their meds are labeled properly and consistently. So when they go up to the unit, they're tracked properly. They get assigned to the patient, and then the clinician that's doing administration has to make sure, as Lori said, right patient, right time, right med, right dose, right. All the R's that we're up to now, right vector, and those things are very important for making sure that we avoid mistakes and med errors, which really are a key statistic that that's tracked in healthcare.
I'm so sorry, Ken. I got cut off my phone. Can you hear me now?
Yes, sir.
Okay. So did you want me to follow up the first question that you talked about on
yes,
the panel?
please.
Or okay, sorry about that, everybody.
Dive into that a little bit more.
Yeah. Technical difficulty. So just going back to when I got involved in the very beginning, before we could do anything out in the hospital, we had to make sure that the pharmacy had barcodes on all of their meds. And so they were having to break down meds into unit dose solutions and actually printing some barcodes. And this is still done inside a pharmacy. So scanners are used in the pharmacies also to make sure that the correct barcode is put on whatever the med might be. As most of you know, we're attempting to get to the 5 rights, the right patient, the right dosage, the right med, the right time of day, and the right actual way of administering the medication. So those things are all tied in to what the pharmacy does with getting barcodes. Then you've got workflows once the meds get up to the actual floors of the hospital. And there are a number of different ways that that's done. But again, those products could be put into WOWs, the workstations on wheels. They could be put into smaller workstations. The WOWs have actual computers, laptops on them. Barcode scanners, as we saw on the one WOW, can actually be on the workstation on wheels itself, and the meds are kept inside of those workstation on wheels. There are also med carts, of course, that don't have that. They go into the room and have thin clients in the room where barcode scanners are also located. Finally, of course, we have mobility, and that's the majority of what we've been talking about here. So nurses may be scanning outside the room with the med first to pull those meds to bring in the room with them along with the actual phones with our software on them. And then I have seen a hospital or two where they have pharmaceutical people bringing the meds up and then the nurse is actually checking that med, of course, before they administer it to the patient. So those are some of the areas. Lab work is big. Our barcode scanners are used inside the labs also for blood work and things like that. So in that workflow, typically they have a scanner inside of a stand, and they scan barcodes, presenting the barcode with one hand and having the other hand free. Some of those look like a standard scanner like you saw before. We do have another scanner that's actually called our 5200. That scanner looks like a little minion. In fact, the first customer I ever showed it to said, "Can I get that minion in yellow?" And I said, of course, we can't do that because of trademarks, but that little scanner allows them to present barcodes quickly through the field of the scan, and that's what they need to do when they're in the labs. And lastly, of course, we have inventory workflows where they're keeping up with whether it's surgical instruments, it could be sponges that are put into the body after surgery, all of those different products that you can think of in a hospital. Many of them have barcodes on them, and we are scanning those barcodes into inventory-based systems.
Yeah, you mentioned a lot of them, and I know a lot of the people on the phone maybe work in a particular department, but there's a barcode literally on just about everything, and every aspect of healthcare. Materials is often tracked all the way through, whether it's materials management, for more standardized inventory, so they know what. Their systems can track quantity on hand, reorder, par levels, and things like that, but also where they're distributed and things that need to be, either considered a consumable or, in fact, get billed to a patient. So you mentioned, the packaging aspect of, within the pharmacy, and while that's pretty much a nice controlled area with people who are very familiar with doing that, there comes times when barcode labels need to be applied to items. Let's say a tube for a blood draw, a phlebotomist, may get a wrinkle or something, or some problem with a barcode. Do you have a solution, Kent, for reading, difficult barcodes, be it a 2D or a 3D, barcode?
Yes, Ken, that's really a great question. As I mentioned before, we've been doing this for a long time. But what that means to you is there are certain algorithms that had to be written to parse out the information on a barcode. So you guys know a simple barcode is a 1D barcode, something you would see on a product inside of a grocery store. And that 1D barcode is basically just lines and space in between those lines. So there's zeros and ones. But as mentioned before, you've got issues with crinkled barcodes, things like that. We actually have dual imagers in our scanners. And what I mean by that is there are two cameras inside of that scanner, and it allows, with those algorithms, to come down to the most small barcode that you can imagine. And so let's talk about a number of things. You also have to have some contrast to be able to scan a barcode. So plasma bags are some of the most difficult to scan. There is no background. Basically, you're seeing through that plasma bag. And with our glare reduction, which we also have in our scanners, and with these dual imagers, we are able to scan that barcode very quickly. And we're able to do that not just with our barcode scanners, but of course with our software Cortex decoder. And since we've got a million devices out there, literally, we are scanning every barcode that you can think of in a hospital without difficulty. Even crinkled barcodes, even things that are labels onto test tubes. And you all know, if you're in a hospital, that plasma bags have the actual label printed on it. But then you've got reflective backgrounds too, pills that come in aluminum foil type packs. And we can scan those barcodes also because of the glare reduction area that we have. So I think you will see that code can scan any barcode, whether it's 1D or 2D. There are some 2D barcodes also, which we can describe a little bit. A 2D barcode, if you've all got a driver's license, 47 states now have a 2D barcode on the back of your driver's license. And that particular code carries, it has to be parsed out, so nobody can just do this. You have to have the parsing information from the particular state, but you can pull off the name, the address, and the actual birth date of that person. And that is used in healthcare also, because there are check-in kiosks being used now in hospitals where a patient will come into the doctor's office or the hospital will actually bring their license in, and they can scan the back of the license and then automatically populate or automatically let the people there know that the patient has arrived. So there are more than just 1D barcodes being used out there in healthcare.
Wow, that's great, Ken. I appreciate that information. I did not know all of that. Lori, I have a question for you. We have a lot of people here, obviously from healthcare, and they do understand, the things that Kent went over earlier with, the purple top containers, cavity wipes, et cetera. But can you kind of give us a little bit more between antimicrobial and disinfectant ready?
Oh, yes, Ken, absolutely. So antimicrobial plastics are plastics that are injected with additives that claim to resist the bacterial growth over time. However, it does not eliminate the need to clean those devices continuously with those coarse chemical wipes. And it's all due to the increased requirements of disinfecting devices all throughout healthcare. The continuous cleaning of these devices made with antimicrobial plastics, they ultimately degrade over time, thus creating more of a cost for the customer. But devices built with disinfectant-ready plastics have actually proven to withstand the protocol of their frequent cleaning. So using the purple wipes, using the bleach wipes. So with all of that frequent cleaning, it winds up minimizing the spread of the infection, and the protocols prolong the life of the devices, which means a lot lower cost to the end user, to the customer. All of our devices, whether it be our CR2700, our CR1100, our CR1500, are all manufactured and built with disinfectant-ready plastics in order to withstand all of those harsh chemicals that Kent had gone over previously.
Yeah, that's fantastic. It's really important to try to help our healthcare organizations manage their costs properly, and the fewer times that they have to replace a piece of equipment because it's no longer usable, having been broken down by inappropriate use of wipes, or if a less expensive unit was purchased that didn't hold up because of the cleaning processes and they have to replace it very often. That definitely can cost a lot more than than buying a device that can take that kind of cleaning. So Laura, I have a couple more questions for you, actually. So where do you find the most need for the Cortex decoder solution?
Well, as we've been discussing, the most need is within healthcare. But within healthcare, it has been more so a necessity and need with the electronic medical records. So by deploying those applications and integrating our Cortex decoder, it has been able to simplify the workflow and to the users. But we're not just in healthcare. We have mobile checkouts and groceries where our Cortex decoder is utilized. Picking and packing in distribution and warehousing is another area that we find our Cortex decoder in need of. And then also OEM applications. So there are a variety of OEM situations that we have been able to deploy in, whether it be individual kiosks. One of our leading customers is Redbox, and areas like that.
Excellent. Thank you. Hey, I have one more question for you, Lori. Early on in your presentation, you mentioned, enterprise versus freemium in the software. Can you describe real quick just some of the key differentiation, between like a roll your own solution or using the built-in camera or image capture apps? What's the biggest advantage for going with the purpose-built enterprise software versus those other tools?
I'm sorry. So when you go with an enterprise solution, there's a security, and everything today needs to be buttoned down, secured. So by going with those type of solutions, you are you're going to have that security. There's nothing out there that, as far as the freemiums are concerned, the roll your own solution. It's pinging the web, or it's bringing in ads, as I mentioned before. So you've got pop-ups, so you've got interference, and you have, avenues that would come in and hack that security.
I like that answer a lot, especially with the large number of ransomware attacks and other malicious software that's out there. Having something that and can trust has a lot of value. Sometimes uncounted value, but anyways, definitely helps to look at things from an enterprise perspective than just a one-off. Well, that's the end of our panel discussion. We have a couple of Q&As from, questions from the audience. I'd like to get to those if we can. So, Lori, maybe this one's for you. Can you give us more information on the usability for vaccination? And I think the person is asking about, your reference to vaccine tracking earlier.
Yes. Some of the large hospital systems have implemented the workflow of tracking and administering those vaccinations. So we have sold several of our CR1500s, our CR2700s, and we've actually sold quite a bit of our Cortex decoder into those locations, where they're able to bring in, a patient and be able to keep a calculation and a tracking for those larger areas, like say New York in itself. They have a lot of people that they have to track and make sure those vaccines are accounted for. So based on those workflows that they've individually implemented, we've been able to supply them with different avenues of being able to collect that data and be able to populate it for their records.
Great. Thank you so much. Ken, maybe a question for you. How do we get the software downloaded to the mobile device?
Yes, that's a great question, and it's let's just talk about Epic first. As mentioned before, Rover is their mobile product, but what we do is we want to emphasize that we are more than happy to give a free demo to any hospital that wants to actually look at it. And we can do that whether it's Epic, Meditech, Allscripts, or Cerner. With Epic, in their case, what would happen is you would quickly fill out a little link to get yourselves into our portal, which basically you gain access to the portal with your email address that you put into that link. We then send you a long key, K-E-Y in parentheses, that actually the key you copy and paste. It's numbers and letters. You copy and paste that right into Epic. So Epic has a place on a particular screen that you just copy that right into it. And that's where we talked about before concerning the security, how easy it is and secure it is inside of Epic. So that's for the demo, and it's the same thing once you've bought licenses. Once you've bought licenses, the same type of key is sent out to you, and you do the same thing to put it inside of Epic. And then we can talk about the other EMRs also because we're working with them too. But it's very simple.
Great. Thanks, Kent. Kind of sticking with the demo topic, Lori, how do I get a demo is the question. I'm not sure if they mean the software or demo hardware, but maybe you could quickly just, tackle both.
Sure. So whether it be hardware or the Cortex decoder, you would use the same avenues. You would do the same. So whether you reach out to your E+ account rep, account manager, they would be able to connect with us here at Code, and we would all have a discussion, work together, and make sure we match you up with the proper device, with the proper configuration that would meet your needs for your applications. So whether, like I said, whether it be hardware or software, you can either go that route, or you can reach out to us via email. Is at info@codecorp.com. Send us an email letting us know that you're interested in demoing our products, and we'll be able to connect with you again, and then we'll be able to bring in your E+ account manager as well to make sure we align you with that proper, device and or Cortex decoder software.
Great.
Yep.
Thanks. So actually, I'm going to keep you on the hook here for just another minute. And I know we're not going to discuss specific pricing, but what's the typical pricing structure for the Cortex decoder soft scanning software?
Okay. Sure. So for a demo, there is no cost. So right up front, there is no cost for you to test it out, to deploy it, and be able to get a feel for how the scanning is. For example, I know Kent had mentioned Cortex for Rover, Epic Rover. You're able to, if you have the app already downloaded on your device, we can provide you a demo in order to start testing it out on different departments or in a test area, Prague, wherever that may be. So as far as that, like I said, that is for free. But once you have decided to move forward and purchase our Cortex decoder, the pricing structure is based on per device that utilizes that soft scanning application, along with a year tier. So we have 1 year term contract, we have a 2-year term contract, a 3-year term contract, and also a 5-year term contract. So taking all that in consideration, we wind up pulling a package together for you.
Excellent. Thank you very much, Lori and Kent. We have one more question, and with that question, I'm just going to, kind of end us here. The question is, how do I connect with my E+ rep? You have, our contact information here, but also if you need to contact or you would like to reach out and you don't know who your E+ rep is, just reach out to healthcare@eplus.com. And George and I and Mary Chavez, who's our marketing rep, we'll make sure that we get your E+ account executive in contact with you as quickly as possible. For everyone else who asked questions in the Q&A, we will get back to you with those answers. And I believe that we will be making this information available to everyone after the webinar concludes. So Lori, Kent, George, thank you very much to Code Healthcare Innovations for hosting our website or our webinar today. And with
Thanks,
that,
everybody.
Thank you,
Thank you, everyone.